Today we're diving into a rare and devastating neurological disorder, Gerstmann-Sträussler-Scheinker syndrome, or GSS. This journey will explore its origins, how it attacks the brain, who it affects, and what we know about managing this challenging condition. GSS is a prion disease, meaning it's caused by a misfolded form of a protein called prion protein or PRP. Unlike viruses or bacteria, prions are infectious proteins. In GSS, a genetic mutation in the PRMP gene instructs the body to produce this abnormal prion protein. These mutated proteins then begin to accumulate and clump together, damaging brain cells. It's usually inherited, meaning it runs in families, though rare spontaneous cases can occur. The underlying mechanism of GSS involves the accumulation of these misfolded prion proteins primarily in the cerebellum, which controls coordination and balance, and other brain regions. This accumulation forms amyloid plaques, which disrupt normal brain function. The misfolded prions also trigger a cascade of cellular events, including inflammation and cell death, leading to progressive neurodegeneration and the characteristic symptoms of the disease. GSS is incredibly rare. Its prevalence is estimated to be between 1 to 10 cases per 100 million people worldwide. Because it's primarily inherited, families with a known history of GSS are at higher risk. The onset of symptoms typically occurs between the ages of 30 and 60, although variations exist. The symptoms of GS are progressive and can vary significantly between individuals, even within the same family. Early symptoms often include problems with coordination and balance, leading to clumsiness and frequent falls. Cognitive decline, such as memory loss and difficulty with thinking and problem solving, gradually develops. Other common symptoms include speech difficulties, involuntary movements, such as myoclonus, and vision problems. As the disease progresses, individuals may develop dementia and eventually lose the ability to walk, speak, or care for themselves. Diagnosing GSS is challenging due to its rarity and the variability of symptoms. The diagnostic process typically involves a combination of neurological examinations, genetic testing, and brain imaging. A thorough medical history, including family history, is crucial. Genetic testing can identify the specific PRMP gene mutation associated with GSS. Brain imaging, such as MRI, may show cerebellar atrophy and other characteristic changes. In some cases, a brain biopsy may be necessary to confirm the diagnosis by detecting the presence of prion plaques. While GSS is primarily considered a single disease, there are variations associated with different mutations in the PRMP gene. These variations can influence the age of onset, the specific symptoms that manifest, and the rate of disease progression. Researchers are actively working to better understand these different subtypes and their clinical implications. Currently, there is no cure for GSS, and treatment focuses on managing the symptoms and providing supportive care to improve quality of life. Medications may be used to alleviate specific symptoms such as myoclonus, pain, or depression. Physical therapy can help maintain mobility and coordination for as long as possible. Occupational therapy can assist with adapting to daily living activities. Speech therapy can help with communication difficulties. Palliative care, which focuses on providing comfort and support to both the patient and their family, is an essential aspect of management, especially as the disease progresses. Because GSS is primarily a genetic disorder, there's no known way to prevent it in individuals who inherit the mutated PRMP gene. Genetic counseling is recommended for families with a history of GSS to understand their risk and make informed decisions about family planning. The prognosis for individuals with GSS is unfortunately poor. The disease is invariably fatal, with a typical duration of several years after symptom onset. Research is ongoing to better understand the disease mechanisms and develop potential therapies. Recent research has focused on developing methods to detect prions earlier in the disease process, as well as exploring potential therapeutic strategies such as immunotherapy and gene therapy. While these approaches are still in early stages of development, they offer hope for future treatments that may slow the progression of GSS or even prevent its onset. We're continually learning more about this devastating disease, and every discovery brings us closer to potential breakthroughs.